Many people may be thinking about starting therapy as a way to get support.
But the process, that can seem daunting. So how do you find a therapist? And then once you've found one, what do you do? How do you make the best use of your time in therapy? Here to talk about all of this and give some guidelines is our relationship guru, Dr. Kirsten Lind Seal. Thanks so much for being with us today.
It's great to be with you.
I think this is a really tough topic because we know that mental health providers can be hard to find.
Yeah.
Lots of wait lists out there, and also trying to figure out what is the right fit for you. So what do you recommend when someone tells you, I'd like to see a therapist?
Right. So, I mean, that's actually the first and most important question, is saying, wow, you know, I think a therapy session or two, finding a therapist would be really useful right now. You know, people don't always, you don't need to be in a crisis to go see a therapist, but if you realize you've been struggling with feelings of depression, anxiety, if you're, you know, just struggling with sort of how to wake up every day and sort of be cheerful, and or sometimes people, you know, have lost a loved one, relationship has gone sour, and so they just really need kind of a sounding board to help figure out how to create the life that they would like to have, is one of the ways I think about starting therapy. And then when you think about picking a therapist, this is important, and it can be daunting too. The questions to ask yourself is who your therapist is important? I mean, obviously it's important, but do you want to see a man as opposed to a woman, or a woman instead of a man? Does gender, LGBTQ ally, do their, like, who they align with, does that matter? What their stance is on certain issues? Do they take insurance? So all of these ways of thinking about what kind of, sort of imagining who your perfect person might be. Do you want them to be older? Do you want them to be younger? Do you want to see somebody in person or virtual? So these are all the things to kind of think about. Then what I really recommend is for them to ask friends. Have you seen a therapist? Do you have a therapist you like? Check out Psychology Today. You can put in filters for like different kinds of issues that, you know, family issues or relationship issues or depression, anxiety, ADHD. Like, there's therapists who have specialties in all of these places. You can also check your insurance for an in-network list. And then the next thing to do is to ask for a consult. Most therapists will offer at least a phone call. I always do a 30-minute consultation that I don't charge for, because I feel like it's really important that people sort of feel like what that might be like to be in therapy with me. So that's just a practice I've started way at the beginning, and I still do it. And don't be afraid to ask questions. Even if you feel like you don't know how therapy works, you could say to this therapist you're meeting, how do you think therapy works? What can I expect? These are important questions to see sort of how they answer them, really. Sometimes the answers themselves aren't so much important as the fact that the therapist will engage with you in answering questions that you might feel like, oh, is this a dumb question? There are no dumb questions.
What happens when you actually go through that process and you get to the therapist? Then what should you do?
Right. So once you find someone that feels like they click, and what I would say about the clicking piece is this someone you feel comfortable with? Ideally, you know, therapist characteristics that we know are important from the research are things like warmth, flexibility, confidence, openness, authenticity. So all of those feelings, right? Like, do you feel like this is somebody you feel comfortable with, is kind of the overall question. I would say go at least 4 or 5 times, because the first couple of sessions, your therapist is going to be doing asking you a lot of questions and getting a lot of information so that they have a context in which to work with you. So you really 4 or 5 times before, and then if you decide, you know, this just doesn't feel right, then that's a legitimate time to say, you know what, I'm going to switch, or thanks so much, this isn't working out. Those are really legitimate things to say to somebody. The next thing that's really important is that you are actually the most important sort of person in the therapy process. No matter how brilliant or skilled your therapist is, if you don't engage with what they're trying to offer you or sort of how they're working, then you're not going to get the benefit from it. So it's a relationship is what is so interesting about it. Of course, it's not like, you know, you go to the doctor and they say, here's this medication. Although, of course, to be clear, sometimes medication can be a part of it. Some therapists prescribe, some don't. And also taking notes when you're in session is totally fine. And you can ask your therapist to sort of summarize, like, okay, what are my takeaways from today? Like, being clear about what your goals might be, which is something that the two of you together could really discuss. That's also something that can be really, really helpful. And practicing what your therapist has talked about between sessions, also important, so that that's how we shift our habits, is through practicing.
All right. Well, Kirsten, thank you. Great advice here. I mean, super practical, so we really appreciate it.